back to you.
Charlie, thank you. Long-term care services in Maine are facing challenges with staffing shortages and a lack of funds. It's an issue the I-Team investigated just this month.
It's an ongoing issue, and today advocates called for more action. Fox 23's Julia Simone was at the State House hearing from state leaders and providers. She joins us now live from Augusta. Julia.
More than 50 long-term care facilities in the state have closed in just the last 10 years.
The impact of underfunding doesn't stop at the doors of our long-term care facilities.
Advocates who spoke today say facilities are closing because of rising Maine care or Medicare costs, a crisis in the workforce with staffing shortages and escalating costs. The lack of funding and closures of facilities creates a void for the 142,000 people that currently make up Maine's elder population.
The ongoing challenges.
The president and CEO of the Maine Healthcare Association says the limited access to care for Maine's elder population is a significant and growing concern.
Access to care is dramatically decreasing. For example, in 1995, Maine had 132 nursing homes. Today, there are just 79 left. The continued cascade of closures is deeply concerning.
Providers say long-term care lost between 10 to 15% of its workforce during the pandemic, most of which were direct care workers who provide hands-on assistance to elderly people in need. Judy Berg's husband is in long-term care after he sustained a bad fall 2 years ago. They have an insurance policy to help pay for it and received a settlement from Genworth Life Insurance, but that's running out.
They gave us a settlement amount, they reached a problem because there were just too many people using it. And I'm afraid it's going to continue because Maine is getting older.
Today, advocates told lawmakers they need three things to fix the solution. $10 million included in the next budget to go towards nursing homes. They want the cost of living increases funded through Maine Care that account for inflation, and reimbursement rates to be regularly adjusted to keep pace with the cost of care. Providers say the cost of living adjustment, or COLA, works for the benefit of both caregivers and patients.
COLA is not optional. In order to recruit and retain well-trained caregivers, homes need to have Maine Care rates adjusted regularly. These important changes will help preserve and protect access to long-term care for future generations.
Providers say the problem is only expected to get worse, with the state's elder population expected to reach 252,000 by 2040. Live in Augusta, Julia Simone, Fox 23 News at 10.
All right, certainly a big problem, getting bigger. Thank you, Julia. We also have an update now from Waterville, where clinical services at Northern Light Inland Hospital ended today. The hospital stopped accepting